I'm joined by Dr. John Day, one of our cardiologists and a noted researcher and cardiovascular expert who is here with the Intermountain Medical Center Heart Institute. Today we're talking about the common myths of heart disease. So what would you tell people to look for? I mean, is there one thing that I'm experiencing and I say, I got to get to the hospital? Is there anything we can take away from that and say, if you have this, you need to get medically looked at?
Probably, certainly the crushing chest discomfort, particularly if it's radiating to the left arm or to the jaw, that is not stopping. Now, sometimes people may have this only with exertion, and then at rest it goes away. But if you have that crushing chest discomfort radiating left arm, jaw, also you may have nausea, you may have vomiting, you may feel dizzy, lightheaded. These are the signs that you need to get into the hospital, particularly if you have cardiac risk factors. And those cardiac risk factors: smoking, history of smoking, high blood pressure, high cholesterol, family history. So this is even more worrisome. These symptoms in somebody with risk factors, particularly worrisome. But even people without any of the traditional risk factors are still at risk.
Wow. We hear that heart attacks often for most people are fatal on your first heart attack. How true is that?
It can be. It can be. And typically, the ones that are fatal are the ones where somebody may have a heart attack. And then with that abrupt blockage of blood flow to a portion of the heart, they then may go into cardiac arrest. Or it might be such a large heart attack that the heart is no longer able to pump enough blood. And so, yes, it is possible that the first heart attack could be lethal. And that gets to the whole point on prevention. Most heart attacks are preventable. And in fact, in certain areas of the world where they don't have our Western lifestyle, they just don't have heart attacks.
I think we often don't think in terms of being preventable, that we can really take charge and decrease our risk of having cardiovascular issues in our lives. What are some of the preventative things that we can do to really reduce our risk of having a heart attack?
You know, excellent question. And this kind of goes along with one of the myths as well, is that our genes are our future, that it's written in stone. Nothing could be further from the truth. Yes, we all have a DNA blueprint, but what we do, our lifestyles can determine which genes are turned on, which genes are turned off. Even if everyone in our family has had a heart attack, that does not mean that we will have to have one. By making the right choices, we can, like I said, turn off certain genes, activate certain genes, and so it doesn't need to happen. To answer your question, what can we do? There are a few things, and these are on the preventative side. Probably first and foremost is get moving. We need to be physically active. There's actually a term called sedentary death syndrome, and that is so classic in our culture. We sit at computers all day. We sit at desks. We come home. We sit and watch TV. We sit. We need to move. Our bodies were designed to move. Number two is nutrition. Enough cannot be said about nutrition. Now, it's certainly, I'm sure for a lot of viewers, it's very confusing out there because everybody has a different idea on nutrition. You hear of all these different diets and some seem contradictory. You watch the news. One day there's a study on this and the next day it seems to be contradictory. But there are things that we do know, and that is to, as much as possible, maintain a plant-based diet. Fruits, vegetables, nuts, seeds, beans are very helpful for us. Minimize the meat intake. The one exception would be fish. Fish seems to be very cardio protective. Other things that people don't appreciate as well, in addition to being physically active and proper nutrition, is to manage stress. We live in a stressed out society, and it's everywhere. Anxiety and depression and all of these are all tied up with this. we need to focus on managing stress and whatever works for people, whether it's investing in relationships around you, whether it's through exercise. Yoga, for example, can be very powerful at reducing stress. Meditation, just a walk out in nature.
Well, thank you. Again, we would remind you that we are taking questions during today's webcast and invite you to call. Again, if you'd like to call on air with a question, you can call 801-507-2807, or you can go on Facebook to the Intermountain Medical Center Facebook page and post your question there, and Dr. Day will answer it at that point. We have Jennifer from Sandy, Utah, who's called in. Go ahead, Jennifer. Are you there, Jennifer?
Hi, can you hear me?
We sure can.
Yes.
Go ahead.
I'm curious to know, I'm 45 and I'm pretty healthy, but I'm worried about heart disease. What kind of tests can I do to see what my risk might be?
Okay, excellent question. And this is really, looking in a broader sense is as we start to move into middle age, and I'm certainly right there along with you, is what can we do? And if I'm assuming you do not have any symptoms at this time?
No, I don't think so.
Okay, so it's really more on just preventative side. What can I do? The most important part at this stage is in moving into the middle age, worried about heart disease. What can we do? I would focus on risk factors. And that would be, I'm assuming you, because you're concerned about your health, you're probably not a smoker.
No.
Excellent. That couldn't be more important, is to not smoke. Other things would be is looking at your blood pressure. The American Heart Association recommends a blood pressure of 120/80. The closer we can get to that, the better. And if you're lower than that, that's even better. And so watching your blood pressure. Another one would be is getting your cholesterol checked. The American Heart Association recommends that your total cholesterol is less than 200, that's milligrams per deciliter. I would actually take it a step further. As we look at different cultures around the world, if your total cholesterol is below 150, now that's a little bit further, basically you are bulletproof against heart disease. We rarely see heart disease in people that through their diet and lifestyle have a total cholesterol of less than 150. And in fact, one of the areas that's been a fascinating area of my own research is there are rural villages in China where the average total cholesterol will be as low as 80 to 150. And so those are some things that we can do. And then also, as we mentioned, is to stay physically active. The American Heart Association recommends 30 minutes of at least moderate intensity physical activity on most days of the week. And I would take that even a step further, is to also move throughout the day. If you have a desk job, I would encourage you every 30 minutes, every 60 minutes, at least to get up, walk around. It is so important that we move. And then also is to manage stress and whatever works for you. And by keeping these in check, heart disease doesn't have to happen. And I would take it a step further, is it's interesting that even if you are focused on preventing heart disease, and I really argue that the heart is the center of life, and I will confess as a cardiologist that is my bias, but if you are focused on preventing heart disease, your risk of cancer, your risk of dementia, your risk of stroke, your risk of other diseases is dramatically reduced. And so focus on the heart, and you really can avoid a lot of these chronic diseases that are really part of the Western lifestyle.
Well, thank you very much.
All right, thank you so much for your question.
Jennifer, thank you for calling in today. Let's go through some of the myths. Let's go ahead and talk about some of those misunderstood issues pertaining to heart disease. We've long thought heart disease is a man's disease. And we're now beginning to really understand that not only does it affect women, but as they grow older, there's a significant effect that women face with heart disease.
Right. Certainly. That is the common myth. Who gets heart disease? Well, that's older men. But it's changing now. With this obesity epidemic that we're seeing, with more and more people living these sedentary lifestyles, we are seeing heart disease in younger and younger patients. I'm even seeing it since I've become a doctor. And while it hasn't been that long, but over the last 20 years, we are seeing that younger and younger people are getting heart disease.
Wow.
It's not just something that older people get. We are seeing men in their 30s and 40s presenting with heart disease, whether it's a blockage in their heart, whether it's an arrhythmia such as atrial fibrillation, or whether it's a heart attack. And the same is true for women. Women track men, but they seem to be about 10 years later.
Really?
But once again, what used to be something with older people, we are now seeing in people in the 30s, 40s, and 50s.
Wow. What should women know then?
I think it's the same thing that we've been talking about, is if you do not have any symptoms, focus on the risk factors, making sure your blood pressure is in check, your cholesterol's in check. Don't smoke. Stay physically active, proper nutrition, managing stress in your life. If you've already started to develop symptoms, then that is time that you need to be tested to make sure that heart disease hasn't already started to develop. And it's interesting bringing it up is when you look at autopsy studies, even in children now, scary autopsy studies in young adults, you are seeing plaque buildup in people in their 20s or younger. It is happening at a younger and younger age. We need to start changing what we do.
Yeah. And what about the idea that mom, wife, takes care of the family and often puts her healthcare needs at the very last of the list of the family? What would you say to women about really encourage them to be proactive about their health?
They have to. And I see that all the time, is that women tend to, they're the ones who will bring their husbands in to be evaluated. They will take care of their husband, their children, and sometimes they will neglect their own health. But women are also in a particularly important role in that they tend to be more health conscientious. And through that role, they can take a leadership role in changing the way the family eats. And as we can make these changes, as we can focus more on a plant-based diet, I can't emphasize that enough. They are so important. They have many nutrients, antioxidants. They are protective. They can lower your blood pressure. They can lower your cholesterol. And as they can take that proactive role, both within their own health and then also helping to change what the family eats and even the family activities. Instead of perhaps going out to a movie or what have you, maybe the family goes out for a walk. Instead of going on that family vacation where you might do a lot of sitting, perhaps it's a family vacation where there's bike riding or hiking.
Great ideas. Well, we're going to explore more myths about heart disease. We're going to take a quick break and we'll be right back.
We need to go pick up my mother. She's joining us for dinner.
That would have been good to know. That would have been good to know. That would have been good to know. That would have been good to know.
Some things are good to know, like if you have colon cancer. So regular colonoscopies after 50 are key, because knowing early gives you better odds. Intermountain, live well. Take care of your heart. Your family deserves it. For ideas, go to intermountainlivewell.org.
Let's talk a little bit about supplements. There's a lot of information out there on the web, books. What's your opinion on supplements in terms of their relationship to heart disease?
You know, it's certainly a very controversial area, and in fact, half of all Americans take supplements.
Wow.
So it's something that is very common. The way I view it is, and this is interesting, as I've watched in my career, early on in my stage, we felt that vitamin C was protective against heart disease. So I remember we put all of our patients on mega doses of vitamin C. It didn't pan out. And in fact, some of the studies suggested that mega doses of vitamin C could potentially be dangerous.
Wow.
Then it was vitamin E. And I remember writing mega doses of vitamin E. It was folate. It was beta carotene. Now it's vitamin D. It's all of these others. And fish oil and etc. But it's interesting that one by one studies have been coming out that these mega doses of supplements could have a dark side. The most recent is fish oil. We thought fish oil was the miracle cure.
Right.
5 years ago, every cardiac patient, we were prescribing high doses of fish oil. Now in the last month or so, there's been a report coming out that men taking fish oil may be at increased risk of prostate cancer.
Wow.
And so where do we go?
Yeah.
Unfortunately, there are not a lot of data behind it. There are powerful anecdotes. The supplement industry has become very powerful in the United States. And where do we turn? How can we get unbiased information on it? The way I view supplements is that it's for people with deficiencies. And unfortunately, most of us in the United States with our SAD diet or standard American diet, we will have nutritional deficiencies. And so with patients with nutritional deficiencies, a multivitamin seems to be good. And there have been some randomized, controlled studies, the Physicians' Health Study 2. While it did not show that it did not offer any protection against heart disease, it did show that perhaps cancer risk may be reduced.
Interesting.
So when I view supplements, what we really need to be focused on is to get our nutrients from real food. And I want to emphasize, real food. This processed crap, what we see in these boxes, these cans, basically the whole center part of the supermarket, that is not real food. Stuff with a shelf life of 20 years, that is not real food. And if that is what we're eating, then yes, we probably need a multivitamin. But we can get all that we need from real food. Now, of course, there are some exceptions. If, say, for example, somebody is a vegan, they're just not going to get their vitamin B12. So they're going to have to get their supplements either in fortified foods or in a pill form. Also, for those of us living here in Salt Lake City, or basically anybody living north of Los Angeles, we are going to be vitamin D deficient, most likely, during the winter months when we can't get it naturally. And so people living in northern climates may have to get it. So I've really kind of come full circle. I remember those days of prescribing high doses of vitamin C, vitamin E, fish oil, it goes on and on and on. But now, get it from real food.
Get it from real food. Great advice. Well, we have a caller on the line. Richard from Santa Barbara, California is on the line. Go ahead, Richard.
Hi. I have diabetes, and I understand I'm at an increased risk for heart disease. I wonder what I can do to reduce that risk.
Excellent question. Diabetes is really becoming, first of all, an epidemic in the United States. In fact, according to American Heart Association data, almost 50% of all adults are either diabetic or pre-diabetic. And the scary thing is, most of them do not know. Fortunately, Richard, you already know that you have it. It is possible that it can be reversible. Certainly there are genetic conditions, people that are born with type 1 or juvenile diabetes. That's a different story. But for most of us who develop the adult onset diabetes, it is possible that it could be reversible. People with diabetes, yes, you are unfortunately at risk of increased risk of heart disease, dementia, and many other these chronic diseases. But you can take things into your own hands. You can reverse a lot of it. And it's the same thing that we've been talking about on this webcast. First of all, you need to be physically active, especially diabetics. This can help you to better be able to process glucose. And so physical activity, while it's important for everyone, it's critically important for diabetics. Number 2, proper nutrition. As we can focus more on a plant-based diet and by staying physically active, most people will experience significant weight loss without even trying. And weight loss in a lot of people can potentially reverse diabetes, or at least bring the number of medicines that you need to keep your glucose in check dramatically lower. And so I commend you for watching this, Richard, and this is very important. You can take control, and it doesn't need to be a big increased risk for you.
Great.
That's encouraging. Thank you.
Richard, thank you for calling us today. Again, if you have an on-air question, please call us at 801-507-2807. Or again, you can post a Facebook question on the Intermountain Medical Center Facebook page, and we'd be happy to answer that on air. Let's talk a little bit about numbers. I keep hearing, know your numbers. What exactly does that mean?
Know your numbers.
Yeah.
And that gets to this whole idea, and to our first caller, Jennifer, who asked, what can they do? For people, whether you are still free of heart disease or whether you have already developed it, knowing your numbers. And everybody has a little bit different numbers that they like to look at. There are a few that I like to look at.
Okay.
One would be blood pressure. We've talked about that. The goal is 120/80.
Okay.
Scarily, 50% of all Americans are not at target. Get your blood pressure to target.
Okay.
Through diet and lifestyle, you may be able to do it. In some patients, it may require medications. But get to target. Cholesterol, we've talked about that. The American Heart Association recommends a total cholesterol of 200 or lower. Half of all Americans are not at target.
Wow.
As we talked about earlier, you can bulletproof your heart. 200 is the goal of the American Heart Association. If you can get to 150, with primarily based on diet and lifestyle, you can, in essence, bulletproof your heart, making heart disease very unlikely. Okay. There are some other, certainly some other numbers that you can look at, but for me, I think if we can focus on these two numbers, everything else will fall into line.
That's great. So blood pressure and know your cholesterol numbers, which means you need to be having those checked on a fairly regular basis.
Exactly. Absolutely.
Yeah.
Absolutely.
Great. We have another call. Jackie from Bountiful, Utah. Jackie, welcome.
Yes, hi. Thanks for taking my call, Dr. Day. My question is, I occasionally will have, my heart sounds like it feels like it skips a beat. And my dad has atrial fibrillation and has had several procedures. And so I'm just curious to know if that's something to be concerned about. Do I need to have it checked out? What do you think?
Excellent question. And in fact, that's right, particularly up my alley, is that as a heart rhythm specialist, most of what I'm seeing is atrial fibrillation. And so before we get to your particular question, maybe I can just take a step back, since that is your family history, is atrial fibrillation. Atrial fibrillation, we are really seeing that it is becoming an epidemic in the United States. And it's not just that we're aging as a society, but this whole part of this obesity epidemic, we are seeing more and more cases of atrial fibrillation. When we look at the causes of atrial fibrillation, really the big three are age, and unfortunately there's nothing we can do about that. High blood pressure. By keeping our blood pressure in check, we can help to decrease our risk of developing atrial fibrillation. And then third, by maintaining a healthy lifestyle, avoiding being overweight or being obese, we can also dramatically reduce our risk. Certainly there are genetic factors that are beyond our control, but for most people, if we can focus on keeping the blood pressure in check and a healthy lifestyle, atrial fibrillation doesn't need to occur for most people. Why do we worry about atrial fibrillation? Atrial fibrillation is in a rhythm where it's characterized by a very rapid and chaotic pulse. People will often experience chest discomfort, shortness of breath, dizziness, lightheadedness. But interestingly, in the elderly or in older people or people who may not be active, they may not have any symptoms at all. So it's particularly important to check this. And there is a simple way, and that would be is just take your pulse. Wherever you can feel it, whether it's in your wrist, whether it's in your neck, take your pulse. You want your pulse ideally somewhere around 60 to 80, I would even say 50 to 80 beats a minute and regular. With atrial fibrillation, every beat is going to get chaotic. If you're concerned that you may be suffering from it, then that would be something to be checked out with a physician. So to answer your question, your heart occasionally skips a beat. Should you worry?
Yes.
It's actually, the heart is such an amazing organ. It beats 100,000 times a day, day in, day out, over year after year. And in everybody, the heart will skip a beat occasionally. That is something that is normal. And to what degree may vary from individual to individual. Oftentimes people will feel that if they have caffeine or not getting enough sleep or they're under a lot of stress, their heart may skip more than others. But it can also be a sign of whether or not you may have atrial fibrillation or another arrhythmia. Most likely what you're experiencing is benign. The way to find out for sure would be, for example, to take your pulse or to have to see your physician, and they may prescribe a heart monitor. And with that heart monitor, you can then track to see whether you are in normal rhythm or whether you're in an irregular rhythm. For most people who have skip beats, if you're taking your pulse, you might find 3 or 4 or 5 beats in a row, and then it's as if there's a pause, and then it beats regular again. In contrast, with atrial fibrillation, every beat is chaotic. In most people, the heart rate is elevated with atrial fibrillation, but it's not always that way. But to make sure, I would recommend talking it over with your physician, and your physician may or may not prescribe a heart monitor, just to make sure.
Okay.
Did we answer
terrific.
your question?
Yes, thank you so much.
Oh, thanks for calling.
All right,
Jackie,
bye-bye.
thank you very much for calling. We appreciate the call. Let's talk about the dreaded S word, salt or sodium. Now, when we eat fast food, oftentimes we'll see numbers on the nutritional information of 1,000, 1,200, 1,300 milligrams of salt or sodium in whatever we're eating. Help us better understand salt and what's so bad about salt in terms of our risk for heart disease.
Excellent question. Actually, the body does require some salt. Some salt is required. But most of us in America get 10 times more than we actually need. Most Americans take close to 4,000 milligrams of salt each day. Is this a problem? Is it dangerous? Salt can cause a lot of problems. First of all, it raises your blood pressure. And high blood pressure, day after day, year after year, can lead to conditions like atrial fibrillation, like we've talked about. Also, it can wear out those arteries, all of those pipes delivering blood throughout your body. If it is subjected to high pressures, it can wear out the kidneys. It can wear out the brain, causing strokes. It can wear out the heart. If the heart has to pump against this high pressure day in, day out, year after year, it can wear out the heart and cause heart failure.
We almost think of it as overinflating your tires, and the tires being as the vessels, and they're expanding, and to a certain point, they can't expand anymore, and they burst.
Right, that could be one way of looking
Yeah.
at it. And so then the question is, what can we do about it? And unfortunately, like nutrition, there's some confusion around this. The American Heart Association recommends 1,500 milligrams of sodium each day. Now, the Institute of Medicine recommends 2,300 milligrams of sodium each day. The typical American gets 4,000.
Wow.
What should you listen to? I will admit, as a cardiologist, I am a little bit biased, and I would argue for 1,500, but certainly at least below 2,300. How do we know? As you mentioned, read the labels. You would be surprised how much sodium is in processed foods. And to get that, as I talk with patients about it, the first thing they tell me is, "Doc, I never salt my food." Well, we get 80% of our salt or our sodium from processed foods.
Wow.
And so read the label. You'd be surprised. A simple can of soup could have over 1,000 milligrams of sodium. Other things like pizza, one slice of pizza could get you there as well. So you've got to read the labels.
That's great information. Well, we appreciate you visiting with us today, and we appreciate your participation in today's webcast. John, appreciate you. Thank you so much for
my
your
pleasure.
time.
Thanks for having me on.
Again, we encourage you to follow us on Facebook. We'll have future webcasts coming up. And again, if you have additional questions, please post those on our Facebook site, and we'll get those to Dr. Day so he can answer those. We welcome as many questions as possible. Again, thank you so much, and we appreciate you joining us. Have a good day.
Thank you.